Good morning, good afternoon, good evening, from wherever you are calling in. We welcome you. My name is Lois McCloskey. I'm from the School of Public Health at Boston University, director of the MCH Center of Excellence. I am joined by my colleague Anissa Saleh, also from Boston University, and my colleagues from from Harvard School of Public Health, Dr. Henning Tamir and Kimberly Pinkowski. All of us together host a webinar each semester, each season, for our audiences far and wide. And today, of course, we are really thrilled to be hosting this webinar and welcome you to Heat and the Health of Mothers and Children, Impacts and Resilience in Action. What could be a more critical topic for this season, for this year, this time? I'm especially thrilled that you have joined us from so many parts of the world. We have members here from Bangladesh, from India, from the UK. We have folks who are academics from all over the United States, from New Orleans, from North Carolina, Vermont, California. And we have folks here from community-based organizations, non-governmental organizations. There's one from Hawaii. Welcome. Feel free to put in the chat where you are located. And we have folks who work on the ground, grassroots organizations, as well as scientists and all kinds of public health professionals, and most importantly, cross-sectoral. This is a cross-sectoral topic, as well as a cross-national geographic topic. So as you're chatting with us, telling us where you're from, I'm going to take a moment and simply introduce our 5 speakers today. I'll do all of it so that they can begin and the presentation will flow one to the next. And then at the end, we will have at least 10 minutes, perhaps more, for questions and answers, which my colleague Anissa and I will curate. And we just look forward to this conversation. And I will begin by introducing the first 2 speakers, both of whom are scientists. Dr. Kari Nadeau is the John Rock Professor of Climate and Population Studies and the Chair of International Environmental Health at Harvard T.H. Chan School of Public Health. Thank you, Kari, Dr. Nadeau. And from the Boston University School of Public Health, Dr. Amelia Wesselink, who's Research Assistant Professor of Epidemiology. They will speak to us about the impacts of heat and the health on children first and then mothers. And then we are so honored and fortunate to have 3 practitioners working at the grassroots level and the city local level on heat resilience. And these speakers are Zoe Davis, the Senior Climate Resilience Project Manager for the City of Boston, Zainab, Senior Research Analyst for the Praxis Project, and Esther McCant, CEO of Metro Mommy Agency. So what a bundle of riches we have to explore this topic, and also what a fantastic audience we have now. Far over 130 people. So welcome, and Dr. Nadeau, I will now turn it over to you.
Thank you so much. It's a pleasure to be here. And I see in all of the chat, thank you for introducing yourselves. It's wonderful to see that there are people from the north, the south. Heat waves are affecting everyone now. So you'll see in my slides that are going to be shared with you shortly how important being able to understand heat and how it affects children and pregnant women is critical to our understanding of individual health as well as public health. So if I could have someone share the slides, that would be wonderful. Thank you. So I'd like to start about what we know and what we can do about it. And that's really important, and especially what we know about how populations that are already inequitably exposed are going to be suffering from continuing heat waves. So next. With this in mind, as we focus on children, there's a UNICEF report that I would recommend for everyone. You can find it with that link below that I shared with you. It was recently written in 2024. It represents many different authors from many different parts around the world, but importantly, really complements our understanding of climate change, how climate change and severe weather patterns are affecting children. And there are some key facts, which are that approximately 1 billion children, nearly half of the world's children, live in extremely high-risk countries, i.e. those that are going to be at high risk for heat waves. And heat waves typically are defined by more than 3 days in a row of greater than 90 degrees Fahrenheit temperatures. But importantly, heat waves with children and with pregnant mothers are really important to be able to define based on their own bodies and their own health needs and other factors that we'll speak about today. Unfortunately, the report that UNICEF provided, that was done by many scientists as well as community workers, has shown that every child born on this earth today will likely be exposed to at least one climate severe weather event. And that will not only take a toll in terms of heat stress, but also mental stress as well, which I hope many of you will ask questions about at the end of our panel. Children in the countries that are most affected by climate change contributed the least to the problem in the first place. Those that have emitted the least greenhouse gases, unfortunately, are suffering the most from climate change associated consequences in health. And when we think about those environmental threats, we also need to look at a lifetime that children are on this planet. So next. So when you think about the panoply of issues that a child can unfortunately suffer through, not just for heat-related events, but also air pollution, unfortunately, 2 billion children, almost 90% of children now live in levels that exceed the WHO threshold for safe and healthy air pollution levels. There's more cyclones, more heat waves. Over 1 in 3 children are going to be exposed to heat waves at some point in their life as a child. Riverine flooding, coastal flooding, water scarcity also is going to compound the issues around heat waves, and that's very important as we discuss how to prevent and how to treat heat-related conditions. And then vector-borne illnesses, also a reflection of our global environment changing and warming. In the next. So I want to really focus on 5 climate stressors as we think about heat stress and how it relates to other issues that any child could potentially be facing, and especially for people in the US, for those populations that are already inequitably exposed, and children really are one of those vulnerable populations that we need to focus on as public health officials, as people that care for children and how they are developing. But seasonality really plays a role. As we think about the warming planet, we're also having increased pollen season. And as we're thinking about more days that unfortunately are hotter, typically now across the last 10 to 20 years in the US, you have doubling of the number of heat waves. So where we used to have about 2 months of heat waves overall, now we have 4 months. So, and that is driven even worse with air quality that can also affect how heat affects the body if that is additionally exposed with air pollution, and then also other issues with flooding, for example, with molds, and then infectious diseases. We like to think of these climate stressors in categories, but when we think of any one child, they can have exposures to these 5 climate stressors at any one point in time, possibly all 5 at once. So we need to think about the compounding issues here with extreme heat exposure. Next. So let's talk very specifically about heat effects on children. First, excess heat in children can lead to fainting, muscle breakdown, organ failure, seizure, coma, or death. And that can occur very rapidly because children don't have the same buffer systems as older adults do. It's linked to poor cognitive function. For example, for every degree Fahrenheit that's increased in the classroom, you have a 1% decrease in the ability to take a test if that test is given similarly. So again, you go from 100% to 75% with a 25-degree difference. Within a lot of heat waves, that's exactly what's occurring. And if we don't have air conditioning, if we don't have ways to reduce that, you're going to have these poor cognitive function measures as an output. Children are at greater risk for developing anxiety or depression due to high heat. There are also heat islands and lack of access to air conditioning or reduction in temperatures that can exacerbate these effects. And then importantly, increasing humidity. So wet bulb temperature is an important index that we can look at when we think about how to monitor, measure, and manage heat waves. And that also impacts children's health. Next. When we look at emergency department visits, this is a really important output measure as we think about public health and populations being affected by heat waves. Data right now have shown in the kids inpatient database that documents about 22,000 emergency department visits per day between May and September. And so when we think about hospital systems and resiliency, we really need to prepare the public, prepare public health departments, create documents for education, but also make sure that our emergency departments have the wherewithal, have the tools needed to help protect and treat children. So that's about equivalent to 3.4 million per summer, and those numbers are only expected to increase. Even temperature increases of 1 degree Fahrenheit between May and September would increase the number of ED visits at children's hospitals across the nation by 113 visits per day. And right now, our hospitals are being swamped with this particular saturation with heat waves. And we need to do more on assessing these issues around hospital resiliency, as well as making sure that our communities are prepared. Next. In looking at the median number of ED visits among children and adults, this is a great paper that I wanted to make sure people knew about. It was written by Ari Bernstein, previously at the Harvard School of Public Health and director of Sea Change, now at the CDC, running a lot of the environmental work there, and Greg Wallenius, who is also at Boston University overseeing the climate change NIH grant. And when you look at this data that was published in Environmental Health Perspectives in 2022, this map shows the locations of participating children's hospitals. You could imagine, and I saw that someone here is from Miami, so here there on the map as well, that unfortunately of the 47 hospitals here, and looking at less than 18 or equal to 18 years of age, you can see the maximum temperatures between May to September. And this is the data that I was quoting from. And you can look at the diameter of the circle and how many visits per day. So you can imagine that the southern part of our country sees more visits, but that also occurred in the northern part of our country. So New Jersey and parts of Virginia and Massachusetts. So these are things that are going to happen in all parts of the world. Next. And when that was looked at since about 2009 from another paper that was published by Chapman et al. In Environmental Research Letters, you can see here in Africa that the heat-related child mortality under 5 years of age has been at least doubling what it would have been without climate change. And if anyone's interested as to what degree an extreme weather event or a heat wave is attributed to climate change, there's a great resource that's called Carbon Brief. And so that's written by climate scientists to be able to attribute heat waves to climate change. So as you go out now after today's talks, among many of my colleagues here, please multiply this message. Many of the heat waves across the world are unfortunately attributed to climate change. And you can see some of that data here in Africa in terms of annual average mortality in children, especially over the last decades. Next. And like I said, cognitive function is affected. And so for all of us as pediatricians, as healthcare professionals, as people that focus on maternal and child health, as well as parents and family members and friends, this is something that really does affect how we view the world, and especially when it has to do with cognition in children. So the performance of schoolwork here is an attribution to temperature change. You can see the relative performance decrease due to increased temperatures. Next. And so the projected additional impacts of heat on learning among children and estimated distribution of loss to future income is really important to look at. This is a paper that was published by the EPA. So again, I would urge you to look at this link and make sure that you can follow this wonderful report that shows a lot about the loss of what we would attribute the cognitive function issues around heat waves with children. Next. And then this is my summary slide that children from underserved communities are at higher risk because of them being inequitably exposed. They live in older homes with poor insulation, live in urban heat islands, and also live in areas with less tree cover. So all of this concatenates, and especially for those children that already live in communities that are inequitably exposed, they will be hit the hardest. And we need to make sure as we think about solutions that we leave no one behind, especially children in underserved communities. Next. So to slide, we'll leave you with one solution, which is a great paper published by my colleagues at Yale and other cities around Europe, that by increasing tree cover in cities by 30%, you actually reduce premature deaths by 1/3. So this is a really nice message to take home from today. Plant trees, increase tree canopy, decrease premature deaths due to heat waves. Next. And I want to thank all of you. I want to thank Boston University and thank Harvard for putting on this wonderful panel. So I'll end there. Thank you.
Next slide, Scott, please.
All right. Hi, everyone. Thank you so much for being here. My name is Amelia Wesselink, and I'm going to spend a few minutes reviewing the state of the science on extreme heat and pregnancy health. So really answering the question, what do we know about the effects of rising temperatures on the health of pregnant people and their babies? Next, please. So many of the normal physiological changes that happen throughout the course of pregnancy can really make staying cool a challenge. They can compromise thermal comfort and truly make you feel like you are sweating for two. Pregnant people are carrying around more weight. They have a lower skin to body mass ratio, which has implications for sweating. And the fetus itself is producing heat. So there is this endogenous source of heat production as well. Thankfully, our bodies have developed adaptive measures to facilitate staying cool. And this includes things like lowering the core body temperature, lowering the sweating threshold. And studies have shown that pregnant people are indeed effectively able to thermoregulate and maintain a normal core body temperature. However, they are at higher risk of dehydration and are potentially more vulnerable to heat stress relative to non-pregnant people. Next. Exposure to extreme heat can be truly devastating for both the fetus and the pregnant person. So first, we'll review effects on the fetus, which are shown on the left-hand side of this slide. Some of these effects of heat are observed at a threshold when the pregnant person is actually overheating, such that their core body temperature rises. And a notable example of this is that heat is known to be teratogenic, which means that maternal hyperthermia or overheating can directly cause birth defects. But most of the effects of heat on pregnancy outcomes are evident and observed even in the absence of acute hyperthermia or overheating. Heat exposure during pregnancy has been associated with a wide range of adverse pregnancy outcomes. And this includes restricted fetal growth, higher risk of preterm birth, and higher risk of pregnancy loss, including both miscarriages and stillbirths. Some of these effects are acute. So for example, there's evidence that a heat wave or hot temperatures can actually trigger preterm birth. Whereas other effects are more chronic and result from repeated exposure over extended periods. So the evidence of an effect of heat on restricted fetal growth shows that higher temperatures throughout the second and third trimesters are associated with being small for gestational age. Aside from pregnancy outcomes and effects on the fetus, there are also effects of extreme heat on the health and well-being of the pregnant person. Although I will say this research is still kind of in its infancy. And some of these are shown on the right-hand half of the slide. So extreme heat has been associated with higher risk of severe maternal morbidity, particularly indicators related to cardiovascular health. There is evidence that heat exposure in early pregnancy can affect the development and function of the placenta, which can put people at subsequent risk of preeclampsia, other hypertensive disorders of pregnancy, as well as life-threatening and pregnancy-threatening events like placental abruption. And then finally, in the general population, it's well documented that extreme heat can adversely affect mental health. And this has recently been shown in pregnant people as well. So psychiatric emergency department visits among pregnant people increase during hot weather. And this is particularly true for symptoms of anxiety and depression. Next. As the climate continues to change, heat waves are becoming more frequent, longer lasting, and more intense. And this has the potential to exacerbate existing racial and socioeconomic disparities in reproductive outcomes. One of the reasons for this is that racially, socioeconomically, and otherwise marginalized communities are more likely to experience the effects of climate change. And this includes being at higher risk of exposure to extreme heat. And Dr. Nadeau mentioned a lot of these features in relation to children, but it's also true of pregnant people from marginalized communities. So they are less likely to have access to air conditioning and other cooling resources like neighborhood green space. They are more likely to experience energy insecurity and to spend a larger portion of their income on their energy bills. And they're more likely to work outdoors and less likely to work in climate-controlled environments. And then, in addition to being at higher risk of exposure to extreme heat, marginalized communities may also be more vulnerable to the effects of heat due to their increased likelihood of experiencing other physical and social stressors that can shape pregnancy health. Next. So, despite the robust scientific evidence that heat is harmful to pregnant people and babies, laws and policies in the US to protect pregnant people from extreme heat are severely limited. One analysis that was conducted by the Human Rights Watch reviewed 105 heat action plans from across many major US cities and found only 2 that addressed the danger heat poses to pregnant people. In addition, there are currently no federal occupational heat protections for anyone, pregnant or not. The Biden administration last year announced an OSHA heat standard for indoor and outdoor workers, but it is expected that this will not go into effect until 2026, if at all. The recently passed Pregnant Workers Fairness Act offers a glimmer of hope. This act allows pregnant people to request, quote, reasonable accommodations to protect their health in pregnancy. Theoretically, this could include reducing occupational heat exposures, but the law does not explicitly address heat. Regardless, the bottom line is that public health policy and practice are really lagging behind the scientific evidence on the dangers of extreme heat exposure during pregnancy. Next. Continuing to advocate and fight for federal and state legislation is, of course, essential, but climate change is a public health emergency, and pregnant people and families and children don't have time to wait. Community-based and local action is urgently needed to protect these vulnerable populations from extreme heat. And so for the remainder of the webinar, we're going to hear from 3 leaders in the field who are working at the intersection of climate change and maternal child health. First, we'll hear about a needs assessment conducted among childcare providers during heat emergencies. And this was done by the City of Boston's Climate Preparedness Team. Next, we'll hear about a survey on environmental and climate justice that was conducted among birth workers in New Orleans. And finally, we'll hear about a community-based organization in Miami that's focused on training and supporting doulas to act as frontline climate workers. Next. And thank you so much.
Hello, everyone. Thank you all for being here. My name is Zoe Davis. I'm going to share about heat preparedness in Boston from the policy and climate planning perspective. While it's understood that infants, children, and pregnant people are heat vulnerable populations, there's a lot of opportunity to further integrate these provisions and to develop programs tailored for their unique needs. And so I'm going to briefly share about the city's plan for heat resilience, and then I'll talk a bit about some of the learnings from a recent focus group survey that was mentioned previously about heat resilience with caretakers. Next. So to define the city's approach to heat resilience, we released the heat plan in 2022. This is a comprehensive framework to prepare Boston for hotter summers. This is a citywide plan with a focus on areas where extreme heat risk and present-day social vulnerability and historic disinvestment overlap. These focus areas were used to guide the community engagement process, which was really core to informing the development of strategies that would reach residents. Next. Next. Next, one more time. Thank you. So as a part of this work, we have defined a series of goals for resilient design. This includes working to reduce high temperatures in temperature hotspots, both indoor and outdoor environments, helping residents adapt to heat and looking to expand choices for folks to stay cool and ensuring that cooling resources and social services are reaching people. And then lastly, designing with sensitivity in mind, thinking about how we create healthier and more connected neighborhoods by understanding underlying social determinants of health. So if we flick to the next slide, we've defined 26 core strategies to increase access to cooling resources and also reduce localized temperatures across the city. What you see here are the 8 main types of strategies outlined in the plan. This first layer, including operations and communications, cooling during heat waves, looking out for neighbors, which is more so around community health, and then awareness, education, and training. These are strategies that are more programmatic and operational. The second layer of strategies focuses on how we can affect the urban form to reduce temperatures. So this includes public and private buildings, our parks and open spaces, rights of way and infrastructure, and how we are introducing provisions for heat resilience into planning, zoning, and permitting as well. Next. So as part of our programmatic strategies, the Office of Climate Resilience, my office, the mayor's office, as well coordinated with the city's Office of Early Childhood on a survey of licensed care providers to understand how they keep everyone under their care safe during extreme heat days. This included responses from both center-based organizations and family child care providers from about a third of all providers in the city. Next. We learned a lot from how providers use their spaces and also public spaces, as well as how they receive information about heat emergencies and the strategies that they use to keep everyone in their care safe. But I'd like to draw your attention to what we learned about how childcare providers are thinking about preparing and planning for heat emergencies. What you see on the left is a graph in response to whether care providers have emergency heat plans. And while there are many providers that have a plan for when we experience extreme heat conditions, we learned that over a third of CBO organizations and just under half of FCCs, our family care providers, they don't have a specific plan for heat emergencies. Additionally, though, these are organizations who would also be interested in additional supports for planning and preparedness overall. So this list on the right, while it's not exhaustive of all of the strategies that we could be working on, these are some of the ways that we're exploring to support care providers. So the first is supporting individual plans for care providers. Second is building awareness around Alert Boston. This is our local emergency alert system for all types of emergencies, not just extreme heat. Third, thinking about how we can increase shade for public parks and playgrounds. And then finally, continuing outreach and awareness building, both with all of the organizations that participated in this survey and reaching out to others as well. Next. So thank you all, and I look forward to answering questions.
Hi, everyone. Happy that you all are here with us today. My name is Zainab, and I will be discussing birth workers as environmental justice agents for a sustainable world. Next slide, please. So I am a senior research analyst with the Praxis project, which is a fiscal sponsor that supports projects working to achieve health equity and justice across communities. However, this work is important to me personally, as my father is from Freetown, Sierra Leone, my mother is from Arroyo, Puerto Rico, and both places are greatly impacted by extreme heat and other climate events. And I've seen how they've directly impacted many of the women, mothers in my family as well. Next slide. So just to provide grounding, I am a community-based researcher. So my research is really focused on uplifting community lived experiences and collaborating with community as experts. And in all of the research that I do, I utilize a reproductive justice lens. And so reproductive justice is defined by Sister Song as the human right to maintain personal bodily autonomy, to have children and not have children, and to parent the children we have in safe and sustainable communities. And recognizing that the climate crisis and extreme heat is a direct threat to the safe environment needed to parent children. And so to fully understand how to properly create climate solutions that center reproductive justice and birth equity, we must also mention the systemic manipulation of Black community through environmental racism, which leads to, but is not limited to, reproductive harm caused by toxic waste facilities in Black communities or racist policies that influence housing, food, emergency responses, and healthcare. And so I try my best to utilize this lens and also think about intersectionality when engaging in my climate change research. Next slide. And so just to highlight one project that I have been working on, titled the Environmental Justice, Reproductive Justice, and Perinatal Community Health Workers Survey. Not sure if I mentioned before, but my focus in my community-based research is in Black maternal health transnationally. Next slide, please. And why we want to survey birth workers, we recognize that birth workers spend a lot more time with their clients throughout the duration of the pregnancy and postpartum compared to some healthcare providers. So we recognize the ways in which they are already part of the community and trust in the community and have access to resources. Next slide. And so this is a view of the research team that came together. It was more informal research to help us get an understanding of the ways in which birth workers feel about the climate crisis, extreme heat on their clients, and if they want more resources or more training. Next slide. So just to highlight a few of the takeaways that we got. First, are your clients exposed to any negative climate change impacts? A great majority said yes. Next slide. Please list any climate change concerns in the geographical area where you work. And we see that hot weather extreme heat was highly mentioned, and we had responses from across the US. Next slide. Do you provide any guidance or information about pregnancy health harms from extreme heat? And we see half said yes, which is great, which means that they are already actively doing this work. And then we see that 34% stated no, I would like to, but don't know how to find this information. So this is an opportunity for us to be able to create those resources. Next slide. Would you like to get more training and information on environmental health threats to pregnancy and newborn health? And as you can see, a great majority stated yes. Next slide. So the overall takeaways, and I have a QR code that has the actual write-up of the report along with recommendations, is that respondents are worried about the climate crisis and seeing negative impacts on their clients. They don't think that individuals and families are being properly supported to address these harms. They believe that doulas and birth workers can play a role in environmental justice, and they are interested in more training and resources to continue to do this work. Next slide. As mentioned, I work alongside a lot of community leaders, and I wanted to uplift Birthmark Doulas based in New Orleans, Louisiana. They have a program called Infant Ready, where they support feeding infants in the case of an emergency. This is just one of the few doula organizations that are doing this phenomenal work. And next will be Esther to talk more about her work as well and the phenomenal work she does with Metro Mommy Agency. Next slide. Thank you so much. And this QR code has a lot of resources for you all to read on.
Hello, everyone. Thank you so much. My name is Esther McCant from Metro Mommy Agency, and my goal today is to help you all in the audience realize why doulas matter now, given these rising temperatures and needs. I do want to highlight that I am a Miami native. I'm a mother to 4 boys here in South Florida, where I currently reside. Next. So my role as a maternal health consultant, doula trainer, and mentor has me on a mission to influence, enlighten, and serve women through childbirth and motherhood. So Metro Mommy is created as a CBO to envision a community where we can have clients live in spaces where these birth disparities do not exist or persist. And so what that means is that we're focused on helping them feel prepared for birth and beyond, including this climate crisis, and help them turn and build stronger, healthier families. The primary method in which we do this is through doula support. So integrating trained professionals who provide emotional, physical, and informational support before, during, and after birth. Next. So it's important to note that I love the idea of diversity because it is something that I have strongly focused on, and I have seen quite a bit in our local Miami-Dade County, Broward County, Palm Beach, this South Florida region. We find that a lot of the living wages of these families don't really meet the cost of living here. Part-time work actually makes it ineligible for folks to even request maternity leave benefits. Many of these families are working throughout their entire pregnancies to make ends meet. Many of them have partners who cannot have parental leave time during their pregnancies or shortly after the birth. And we also have a high immigrant population that tends to work outdoors. So our gardeners, farmers, day laborers, construction workers, there's a ton of construction happening all over our city right now. And in general, the general population of residents who have to lean into walking or taking a bike to work, they're often exposed to these stressful high heat conditions to get to their locations, including their locations for their children's school. which oftentimes our pregnant moms are navigating that as well. And so we work hard as doulas to encourage increased hydration to mitigate those effects on those pre-existing conditions that could be there, whether it's hypertension or diabetes. And what we know is that most families want to have a physiological birth, despite many of these challenges of C-section rates and induction rates in our community. And unfortunately, lack of affordable housing is putting folks at risk of high heat exposure because we do have more incidences now of homeless moms who are looking for doula services. And this is the first time, honestly, I've seen it in my career, my decade-long career as a doula. Next. So as a child, I lived through Hurricane Andrew, which is probably one of the most traumatic hurricane experiences for many Miamians. And so as I had a chance to sit in public health committees and do more community engagement, I knew that there were residents who didn't know how to, make their emergency plans. I knew from working with the state, the Department of Children and Families, that not a lot of professional guidance is given to employees and their constituents when they are employees trying to get guidance on extreme heat. And I'm also a trained community emergency response team member through my time at the University of Miami. And so not surprisingly, when 2017 came along and we had Hurricane Irma, I realized as a doula, I really couldn't go necessarily to emergency management because there were no plans in place for really helping pregnant people navigate hurricane and evacuation conditions. And so post Hurricane Irma, when power was out for an extended period of time, it put my client, who was 9 months pregnant at the time, at risk because we were already experiencing challenges in her home where there was already mold already pre-existing. And again, with increased temperatures, high heat, multiple kids in that space, homes became unsafe, right? And so what we've experienced in the last few years, it's pardon the slide there, but the last jump there is a very high first ever heat warning that was ever recorded in history in 2023 for us. Next. So what's next? What are we doing to address it? As Zainab shared, there's a real need for doula training. Doulas are already going to be experiencing 40 plus hours of time with each client that they're serving on average. And so we see that there's this wonderful intersectionality that exists, and we want to make sure that we are connecting the dots. And so we've conducted 2 trainings in Miami with Human Rights Watch. And we are continuing right now, we're in the mode right now with the Florida Clinicians for Climate Action, training doulas through some funding from the CDC Foundation. Next. So it's a MOMSHA program. This is where we will have doulas go through their training. They will be integrated into the workforce, and we will be providing clients through the momsha.org website. And the next slide is just a showcase of some of our partnerships. We do believe in cross collaboration. And as you listen and think about your community, how do you intend to engage and work with doulas to increase your reach to pregnant people? Next slide. Thank you. I'd love to stay in touch.
Thank you to each and every one of you. Wow, our panelists, you did an amazing job staying on time with such an enormous topic. We ranged from science, as we said, to practice at the most local level and city level. And I'm sure you've aroused a lot of curiosity and interest from your talks. I'm here to moderate questions. We have plenty of time. And I'll begin. I want to encourage all of you participants to enter your questions in the Q&A, and we'll take them one at a time. And others on the panel, you may have questions for each other as well. So I'm going to start with this one. Thank you to Ella Whitman. This is directed especially at you, Professor Wesselink, but others may want to chime in as well. Please speak to the potential additive or synergistic impacts of heat exposure and air pollution on pregnancy, birth outcomes, newborn health. how can we even begin to investigate such a complex interaction?
Thank you for this question. I think this is really, really important. Of course, people are not exposed to heat in isolation. We know that hot temperatures influence kind of the composition of air pollution. We know that burning of fossil fuels contributes to higher levels of air pollution and to higher temperatures. So these two exposures are very interactive and often co-occur. And I think even beyond the heat and air pollution piece, a lot of climate hazards co-occur. So you have a hurricane followed by a heat wave, and maybe the hurricane has caused a power outage and no one can use their air conditioning. You have wildfires happening at the same time as heat waves. So we know that these climate hazards co-occur, but the vast majority of studies so far really look at them one at a time, which is not how people are actually exposed. And like you said, the limited evidence that does exist suggests that there are kind of synergistic effects. So in other words, being exposed to one versus being exposed to both, being exposed to both is worse than what you would expect based on the individual effects. So I would say, at a minimum, we need studies that both measure and kind of understand more about the distribution of how these hazards co-occur. Because right now, I think we're not even taking that step to measure. Dr. Nadeau, do you have other comments to add on that?
Yeah, your answer was fantastic. And the question is right on, because we do need to think about multiple exposures in any one individual and those accumulating effects over time. So it's multiple as well as compounded over someone's lifetime. And so there are ways to look at that on the biological side as well as on the statistical side. And so if you're interested, there are some papers out there to help in engaging data scientists with this multi-complex issue, but it's a lot of modeling. And so I think we're not perfect yet, but at least it's being looked at. So I think there's hope to think that we can model this out. But importantly, how can we use it effectively? We also need to look at when a solution comes into play for an intervention at the community level, which is so important as we're talking about today, that we look at those same output measures that we're looking at in terms of multiple exposures and see to what point an intervention actually helped reduce those outcomes, reduced early loss of pregnancy or reduced heat stress and cognitive function in children, for example. So all of these things are great to talk about in terms of multiple exposures, but we also want to focus on solutions and how to measure them as well when we look at these multiple exposures. So thank you.
Thank you both. I want to follow up on what you just said, but before I do, I want to address this other question from a participant, because it goes right to the heart of, Zoe, what you talked about, which is the role that local health departments play. In this case, the person wants to know particularly how local health departments can help spread awareness of heat stress and pregnancy, but I imagine that also applies to the harms and risks to children. So Zoe, you've given us a terrific example, honing in on child care workers in particular, but also Boston more comprehensive plan, or at least mission, to do those 12 kinds of activities you described. I wonder if you know of other cities or of an association of local health departments, for example. How common is this?
Just to clarify your question around how common is this, you're referring to how common is, actually, can you clarify that piece for me?
Sure, what I meant was, it's a twofold question. One
Sure.
is, tell us, to answer the participant's question,
Yeah.
how do you and how can other local health departments spread awareness of heat stress and its impacts? Number one. Number two is, are you aware of other city initiatives similar to Boston's
Ah.
in this realm.
Thank you for clarifying. I appreciate it.
Mhm.
Well, I think to answer the first question, I would say a huge part of this is working with local institutions and community health organizations. They work really closely on the ground with, I mean, of course, their constituents, but other sort of community touch points that folks will go to. And I think working with those trusted partners is one of the best ways to help increase awareness and get information out to the people that need it. And that is definitely something that the Boston Public Health Commission does in coalition with a number of community health organizations across the city. To your question around other programs, I don't necessarily have one that comes to mind, but perhaps other panelists might know of other initiatives across the states or even regionally. Um, no, that might be an open call. I don't know if that's okay.
Yeah, no, that's fine, Zoe. Thank you.
Sure.
And if folks do have information in that regard, please share it in the chat.
I did just share it in the chat for us, if you don't mind sharing it. We do have a Resilient 305 initiative, and it's our strategy to attack these global changes that are happening here in South Florida. So you can check that one out as well.
Good, thank you, Esther. Anyone else want to add to that? Yeah, Dr. Nadeau, go ahead.
Yeah, thank you. There is a lot of work being done at the Bloomberg Mayor's centers, and I think as we think about how cities are being affected, and I'm so glad that Zoe, you're in the mayor's office in Boston, but cities are going to be, I think, amplified in their response to heat waves and how they're dealing with this, and across the U.S., and not just the U.S., but many places. So the Bloomberg Mayor's Conference is a convening ground for this. I also think that many cities across other countries are coming together, and people that are officials are sharing data. So the CDC, the EPA, other organizations have some really nice sheets in different languages now to complement heat waves and climate stress. And now there's a lot of work being done through educational apps for climate. So hopefully that will help too as we think about mitigating heat stress, especially in cities.
Thank you.
I shared one more with
Sure.
the Women's Fund, Heat Health. They did a lot of campaigns for heat awareness and health. I'm sure one of them is on the line. Probably Viviana is here to share some warnings and working very closely with our local police and fire departments and the county as well.
Thank you. So I'm seeing two questions that relate specifically to you, Esther, and to Zainab, your presentation about doulas. Let's take them both on if we could. The first is about what evidence you might know of behind potential strategies to include doulas and other birth workers in this sphere of reducing the impacts of heat. And this person added, do we know that increasing hydration helps? Very closely aligned to that question, though, is this other one. Do you find resistance to doula incorporation in the climate science space? And I think that's all a really important question, because at the same time, right, you've pointed to how critical it is to have frontline workers, doulas and birth workers, engaged in spreading information as well as help. And yet there's so much already on their plate, and it places quite a burden on an already burdened workforce. Perhaps that's where this question is also coming from. So please take that on if you could, Zainab and Esther.
I can add a little bit, but Esther, I'm sure you have a lot more to add. I was just going to speak on a training that Sky Wheeler and I did actually with a group of doulas in Miami with Esther's org, just highlighting the intersection of reproductive justice and pregnancy. But we were also able to work alongside Toni Oberly, who is also a doula and a researcher in this space. And she created this mock workflow or a care flow for how the doula can support their client throughout the duration of their pregnancy and postpartum as well. And discussing foods that are very hydrating, like watermelon, cucumber, the identification of cooling centers that are very helpful, providing resources for if the person doesn't have AC and the doula is able to see that, maybe connect them to those type of resources. So those are the different ways that doulas are connected within their community and mindful of resources that they will be able to then share with their clients directly. But I'll pass it to Esther to provide more information.
Absolutely. I think the evidence is when you have a client who's able to work with the doula at all, we're going to see some improvements in whether it's the birth outcome, the experience of that mother. And so what we know is that the time for a provider to not only provide the care that they need to do, the clinical care, and also the climate action work, is not always there. It's not very feasible. And that's actually why we've partnered with Florida Clinicians for Climate Action, who has locally been training not only providers, but also medical students, right, on climate action work that they could be incorporating. They saw a need and a gap that doulas can fill. And so we will be getting that evidence, is what I can say. But the evidence already exists that doulas can improve birth outcomes. And so when you have vulnerable populations like these and the issues with this extreme heat, we know that it's going to improve something. We know baseline, a lot of our families don't have the emergency plans. And so that is one of the activities that we will be conducting, is making sure that all of our families have one. So that's what I can answer for now. But I do encourage you to also check out March of Dimes MBAN as well, and see how they've already are trying to use an evidence-based model of doula care to integrate it into addressing some of these environmental concerns. And I don't feel the pressure of the discord or whatever that is. And I think if we focus or distract ourselves too much, that will get in the way of us getting the work done. So I'm just focused on being more collaborative and enhancing communication between providers and their clients.
Thank you. Thank you very much. It's 1:59. I'm going to point to the last question and then ask everybody who wishes to give kind of off the top of your head a response, and then we'll close and tell you how we will share the information. And that question is a big one. What are some steps organizations can take to even begin at this intersection of maternal child health and climate change? So anyone who wants to speak to that, what comes to mind?
I think Esther just spoke on it a bit, but collaboration and dismantling silos, I think that's something that exists. I've been doing a lot more presentations on climate change and maternal health spaces, but I haven't really been able to break into the climate space as much. So I think collaboration is key in connecting with folks that are actually having the lived experiences to better inform the work.
Also,
I agree. Oh, so good.
I would say ask, right? Really inquire with the community that you're serving, find out what they actually need, find out who is already inundated by the request and the needs that they're trying to fulfill in your community, and see how you can partner with them, because they will likely tell you some of those answers.
Exactly right. We work with the community health van here in Boston, and we just asked them, what worries about climate change, and they kind of look like, what do you mean? But then when we asked them, well, how about heat stress? That was something that was important to them, or flooding. So I agree. We meet people at the table and see what they need, and also give them that capacity, as they already have, to solve these problems on their own with tools that we can all work together to provide. Because at this point, Lois, it's such a great question, and whoever asked that, because we do have the tools now. So to deliver on that hope and promise, I think is going to be done at the hyper local level with communities, engaging communities, and make sure that those solutions are community driven. And then people are accountable for following through. But those solutions are in hand now, and we can really reduce the risk of climate change associated heat waves as well.
Anyone else with a closing comment before I say goodbye? I'm really thinking about the point you made, Professor Wesselink, about how pregnant people, infants, and I would say probably children also, are not really represented at the table in many efforts of surveillance, state policy making, federal, and connecting that to, well, where you all are ending us, Dr. Nadeau, Esther, others, Zainab, at how important local inquiry and local action is to get this ball rolling, because we have a lot of work to do at this intersection. Can't thank you all enough for the resources, your knowledge, your insights, but also the resources that you'll share. I want to assure all of you who are left on the call that we will be sending you the recording, as well as slides, as well as contact information and any resources that appeared in the chat sometime next week, to all who attended and all who registered. Thank you, and goodbye, good day to everyone.